Aloha and welcome to today's national webinar, Ka Holo ʻAna I Ke Kai Hohonu, Generations of Resiliency, a national electronic training presented by the U.S. Administration for Native Americans in recognition of Native Pacific Islander Heritage Month, which is May. Today is May 25th, 2017. Thank you for joining us. So like I said, this session is being presented by the Administration for Native Americans and produced by the Pacific Region Training and Technical Assistance Center, a resource of ANA. My name is Matthew Ng. I am the Technical Assistance Specialist here at the ANA Pacific TTA Center. We are located in Honolulu, Hawaii, and we serve the Native Pacific Islander and other Native communities in the Pacific region. If you'd like to learn more about us or to utilize our free services, you can visit our website at www.anapacificbasin.org. So a little about the Administration for Native Americans. ANA promotes self-sufficiency for Native Americans and Pacific Islanders by providing discretionary grant funding for community-based projects and training and technical assistance to eligible tribes and Native organizations. And ANA's vision is that all Native communities be thriving, and so they'll be working towards that vision as they continue their good work. And you can learn more about ANA on their website, which is listed there on screen, www.acf.hhs.gov/programs/ANA. So this webinar that you are currently attending is part of a series of online trainings that ANA offers. So every Thursday or every other Thursday, ANA usually will produce a national webinar on a topic that is useful for the development of Native communities. The current one that you're in, like I said, is in recognition of Pacific Islander Heritage Month, where we'll be featuring some Native Pacific Islander community groups. But next, we will have a session on tourism. So that will take place on June 8th, hosted by the ANA Alaska region, Introduction to the Native Act, Creating Economic Development Through Cultural Tourism. And if you'd like to register for that, you can go to the Alaska region's website, www.analaska.org, or you can visit the events page on the ANA website, where you can also find other upcoming webinars hosted by its 4 regions. Tourism, that's a great topic right now, especially since it was added as an area of focus on ANA's latest published funding opportunity announcement for SEDS. If you are applying for an ANA grant, know that grant applications are due in about 29 days. So if you're interested in applying for an ANA grant, please visit ANA's website as well. So let's get into today's webinar. As I said, it's in recognition of Pacific Islander Heritage Month, which is May. And in today's session, our goals are, 1, to better understand the Native Pacific Islander communities, specifically with a focus on Hawaii and American Samoa. And to do that, we're going to hear directly from 2 ANA grantees from these communities and how they're addressing local challenges, as well as some of the successes that they are experiencing. And they'll also tell us a little about their communities and what life is like in their Native communities. So at this time, I'd like to introduce our regional director here in the Pacific region, Keone Nunes, and he'll say a few words about our region and introduce you to the Pacific. Keone?
Hi. Thank you, Matt. Aloha mai kaua no ki hoi ke ana no ka iki ana I ka poʻe Hawaii me ka poʻe Samoa me ka poʻe Chamorro me ka poʻe mai kekahi wahi aʻe. Thank you guys for coming and listening to the presentation for this. Let me give you a little bit of background for the Asian and Pacific Islander month. We are definitely focusing in on the Pacific Island regions, and but it has a history, and the history started way back in the 1980s when Hawaii Senator Daniel Inouye and House member Sparks Matsunaga introduced a bill that was later accepted and turned into law, creating the Asian and Pacific Islander Week. At that time, we were only afforded a week, and interestingly enough, under the administration of George H.W. Bush, he turned that into Asian and Pacific Islander Month. I know that in Washington, D.C., they have many different events that focus in on the Asian and Pacific Islander communities. If any of you are in that area during the first couple weeks of May, you can stop into the National Museum of the American Indian, and you will have a festival of Native Hawaiian culture with artisans, with hula, and with demonstrations. So it's very interesting that they really have taken this to heart and produced some very important events in the DC area, and for that they should be commended. We should not forget our own heritage within this month. You know, a lot of people in Hawaii celebrate May Day with lay events and things of that nature, but sometimes it's very much focused just on events that are based for other people. But we should always look at things that happen within our own community within this month and throughout the year, of course. But sometimes we need time to be able to focus on some of the things, both good and the challenges that are within all of our communities during this time, because we need to understand that we come from a very resilient culture. We come from a culture that has traveled thousands and thousands of miles through the ocean and settled these very isolated areas. If you look on the map, you see that Hawaii is the most isolated landmass in the entire world. And to have people come up from the South Pacific to Hawaii and bring their influences, people from areas like Tahiti, from the Marquesas, and definitely from Samoa, that have come to Hawaii and influenced Hawaii. And they did it purposefully. And, you know, sometimes we fail to recognize that achievement. You look at the distances between Hawaii and Guam and CNMI, and you'll see that this area was expansive. And although we honor people like Columbus and Magellan for their achievements in navigating and looking at bringing the world together, we rarely do that for the people in the Pacific. And I think it's about time for us to acknowledge the fact that we come from a culture that has been the forefront of maritime navigation in the entire world. And we should really respect the people who are continuing those things, the people who went on the worldwide voyage with Hokulea and touched all the various areas, not only of the Pacific, but the entire world. So I think that all of these things point to a fact that we have not really, as I have said before, we have not really acknowledged the achievements of our ancestors. And all of us are a reflection of the determination and the resiliency of the people. Many of us, after Western contact, really experienced tremendous depopulation. So within Hawaii, there were estimates of upwards of 1 million people living in Hawaii during the time of Cook's first visit. That number by the 1870s went down to under 40,000. And so at least we in Hawaii, and I talk from that perspective because that is the most, that is where I come from. That is the perspective that I know the most. And I would be doing a disservice talking about American Samoa, about the Chamorros and the Carolinians from Guam and Sinai, because I don't come from that experience. So I can honestly say that within my own experience, to understand that we come from a very finite group of people, we have survived. And the resiliency within not only our survival, but the fact that we are proud to practice our culture and to expand on that. And it's not just the traditional culture, it's the things that we do nowadays. It's the activities that we really try and excel in. And for different people, it's different things. You're going to hear from programs today that really look at seeing some of the challenges of today and looking at some of the things of the past to bring them into contemporary context. And within this context, we can move forward as a people to show that it is that we are as resilient in today's society as our ancestors were in bringing us into this world today. So I am very, very excited about it. I'm very much willing to listen to what's going on with the rest of the world, and hopefully all of you will learn something from this presentation. And if you have any questions or anything of that nature that you want to pose to the presenters, that will be made available at the end of the presentation. And if you have any questions for us in Kaʻānaniʻau, just make sure that you let us know, because we're here to serve you guys. Okay, Matt, I'll turn it back over to you, and thank you so much for this time to just share a little bit about who we are.
Thank you, Keone, for that context. That was really a good way to get our minds focused on this region and to understand, the vast history and accomplishments of our people here in the Pacific. So at this time, I'd like to start by focusing on American Samoa. Understand this area. We'll have Miss Catherine McCutcheon. Captain McCutcheon currently serves as CEO and President of Pacific Region Development, an independent, minority, women-owned small business providing consulting and project management services in the Pacific region. She is the Executive Director with oversight of the Pacific Region Health Initiative. A Pacific Region Workforce Development Project awarded to the Pacific Behavioral Health Collaborating Council by HRSA and SAMHSA. She serves as Principal Investigator for multiple federally funded projects with focus on building local capacity through training and certification. Her government experience includes serving as Chief of Staff to the First Lady and Special Projects Director to former Governor Tongiola T.A. Tudafono and DHSS Assistant Director. Her focus is advancing workforce development, technology expansion, and building local capacity for the territory of American Samoa and the Pacific region. As consulting Project Director of Project Tausi Whianganga, Covenant Keeper. This time I'd like to pass it off to Catherine to talk more about her project.
Aloha and good morning, everyone from American Samoa. Thank you very much, Matt, for the introduction. I'm here as the project director for Tausi Whianganga, and that translates into Covenant Keeper. When we were developing this project in 2015 and we wanted to name it, we wanted to find a Samoan name or proverb that spoke specifically to the meaning and the intent of the project and what we were trying to accomplish. And Covenant Keeper came up because it really is about preserving sacred bonds. Tausi Whianganga is a term that refers to the sacred bond between a brother and a sister, where the brother is a protector. It also refers to the sacred bonds between parents and their children. And so we felt that this project really embodied the preservation of those sacred bonds between individuals in our Samoan culture. As a background, during the early 1900s in the wars in the Pacific, the warring powers of the United Kingdom, the United States, and Germany divided up the Samoan Islands into American Samoa and what is known as, used to be Western Samoa. Now they are the independent state of Samoa. In 1900, the United States, by deed of cession, American Samoa became part of the United States, and Germany and the United Kingdom took over and governed Western Samoa until they became independent. Our demographics, our population is a little over 50,000. Probably by mid-year estimates, they're closer to 60,000 now. And you'll see that we're a very monocultural society where the majority of folks are native Samoans. Our per capita income is $6,300 in comparison to that of the United States, which is about $58,000. The majority, or over half of our population, continues to live below the federal poverty level. We have a total workforce of about 18,000 adults, 16 and over, and they're pretty much employed by either the government, the tuna canneries, or the private sector. There is a subpopulation of folks who work and continue to labor the land and do subsistence farming, but for the most part, these are our major employers. We're currently experiencing a very depressed economy that's impacted by any move or change in the fishing industry, especially in the Pacific region. We have very little tourism, although that's something that is very much desired, but the expense of getting here from the nearest port in Honolulu makes it very difficult to really develop our tourist industry. And there's a lack of employment opportunities in the private sector. So we're continuing to struggle with those issues. As a cultural backdrop, and I want to just pause here and express my thanks to Keone for his introduction. And it really resonated with me when he talked a lot about resilience and culture, because American Samoa, or our Samoan culture, is about 3,000 years old. And we are very fortunate to experience the result or the benefit of decisions that were made years ago by our forefathers who negotiated the deed of cession, because they were able to say to the United States, look, we want to be partners with you. We accept your assistance and willingness to help our Native people as far as improving and the quality of life, health, education, and infrastructure. However, we want and we must insist on maintaining our communal land system and our chief system. And I believe that the fact that they negotiated in that spirit years ago has brought us to this day where we enjoy a custom and a tradition that is very much alive. Our Samoan language is still thriving in American Samoa, so much that almost 90% of households still speak Samoan as a primary language. The lands and title system, the chiefs of each clan still govern 90% of the communal land system. And that's a lot of power. I mean, that's a lot of influence, that's a lot of control, and it's really the chiefs who take upon themselves the role and duty of taking care of the extended and communal family. And so we still have a hierarchy of chiefs. Villages and districts are governed by councils of chiefs, so much so that the Senate in our legislature is still selected by traditional custom. The House of Representatives and their membership is elected by the citizenry, but the senators are still selected from these councils of chiefs. So I think we're very fortunate to have the benefit of decisions that were made years ago and the wisdom of our forefathers. And you'll see there that almost 100% of Samoans are Christian. Cultural values and how it interplays with our family and elderly care. One of the things that's really important in Samoan society is we really believe in the old adage of we care for our own. It's considered an honor and a duty to care for our parents as they grow older in age. There's a cultural expectation that children will take care of their parents. And it's this sense of reciprocity. You know, your parents take care of you, they nurture you, they educate you, they send you off to the best school and do the very best for you. But when you're older, you're settled, you have your family, and your parents age, it is expected that you return home, if you've left home, and assume your role and fulfill your duty as children. There was a time when it was very shameful, you know, and frowned upon to have elderly parents or grandparents cared for by others outside of the family, and those in a residential facility. However, we're finding that through my experience on the Hope House board, and the Hope House is actually the only residential facility here in American Samoa, we've got a growing waiting list because more and more elderly folks and our population with disabilities need care that cannot be provided by their immediate family. So we fast forward into the changing demands of modern times, and we find that we've moved from subsistence lifestyle to a cash economy, which of course means that there's an increased cost of living. Families can no longer afford to have someone stay at home and be a full-time caregiver, and that every person in that household must go out and earn money to support their family. So what happens? Families end up bringing in relatives from Samoa to be live-in caregivers. Some families just resort to leaving their elderly loved one home alone all day until the working folks can come home and take care of the evening. But they're unsupervised, they're isolated, there's no stimulation, and it's really not proper care, especially if they're bedridden and immobile. Conditions of American Samoa, of course, you saw that over 60% of our people are very, very low income. So you've got a community where you've got poor people plus non-subsistence farming and fishing equals poor nutrition and health. That's probably led specifically to the prevalence of overweight and obesity in American Samoa. We've got the highest rate of diabetes and chronic NCDs. to the point where we're involved in every regional and national NCD strategic plan. It's also lent directly to the trend of increasing census of dialysis patients, amputations, getting limbs cut off. People are in wheelchairs, they can't move around, and it's all because of this chronic and severe diabetes and multiple complications from the various chronic diseases. We've got a population that's aging very quickly. They're accessing food stamps and services for senior citizens and elderly in the food voucher program. So this led us to our problem statement, where over 65% of American Samoa's elderly and disabilities populations live in isolation with very limited access to proper health care, resulting in premature death. There was a time when Samoans used to live until their late 80s, early 90s, and I think the WHO statistics show that men are dying at 70 and women are dying in their 60s. Our project goal is to address this community problem by increasing the number of skilled community and home-based service providers who have the skills, the knowledge, and the attitude to provide caregiving services in the home. Again, we felt that we needed to create a project where, all right, we have a situation where we've got folks throughout the island who maybe get a visit from a nurse, through the home visiting program, or they've been in and out of the hospital, they're discharge planners. But it would be much better to train up and skill people who can care for them full-time in their home, and they don't have to be admitted to a facility. I mean, it's the reality for us. It's not even as if we have, a high number of facilities available to take everyone in. So we really designed the project with three objectives. One centered around training up the caregivers at the Hope House facility and really giving them intensive training and education from experts in geriatrics, experts in end-of-life care, experts in how to properly care for people with disabilities, people who are wheelchair-bound, who are bedridden, and people from that field. Over the duration of the project, we wanted to broaden the scope and reach of it so that we can take that same training and make it available to people who are in the community who are currently providing caregiving for their loved ones in their own home without having had any proper training or formal education. And in the course of the project, and still over this duration of time, we would take 100 of those folks from the community and help them either become, self-entrepreneurs, become independent business people that can contract their services to the aging office, Department of Health, or the hospital, etc. That's the employment aspect of it. Our project partners are the Catholic Diocese, which operates the Hope House facility. University of Hawaii John A. Burns School of Medicine is our team of medical professionals who come down once a year and provide a very intensive training. And then they also provide monthly webinars. And then our referral access points, which is a variety of government agencies who serve the elderly and disabled population. Key activities of the project include, again, very intensive face-to-face training, this whole list of activities. One of the things that we really wanted to make sure we built into this application was that it's not enough to just do a training. And we know from experience over the years that these 3 to 5 workshop days and then the trainer goes away and there's no sustainability, there's no long-term support. We wanted to make sure this training was provided more than that, and that it provided training over time, that it allowed people to develop those skills, be able to have a process where they demonstrate it. If they're doing something wrong, there's clinical supervision, there's an evaluation piece, and they're allowed to improve. So it is skill development over time. Effective practices, one of the things we've learned going into year 2 with this is we've been very effective in implementing this project, we feel, because it was offered in a bilingual format. We want to remember that a lot of our caregivers have, if anything, a high school education, and no one has ever had any formal training in proper caregiving. And so we had to tailor and accommodate that, and we wanted to make sure that the training content provided by the UH professional experts didn't go over anybody's head. That more important than going through the motions of the training was that all of our participants had a good understanding and comprehension of the content and what is being taught, and they're given time to be able to apply those skills on a daily basis in a repetitive manner and be evaluated over time. And so that the live translation during the webinars, the bilingual translation of all materials so that everything was culturally responsive and relevant. And it lent to this gradual capacity building, that happens over time. The impact on the target population, of course, is we're able to now help our elderly and disabled folks access primary care. Now they have someone that can help them navigate the system, help them manage their medication, make sure they get to their preventative care visits, and it really just improves their quality of life overall because they're able to access all the services that they need. The impact on the community is it allows us to create this pool of caregivers. One of the things that we have not been able to access is Medicare, Medicaid funding, where these services for caregiving are billable. And so one of the key impact indicators of this is being able to take advantage of the Medicare, Medicaid benefits that are available to our community, and be able to bill for those services and provide quality services for people in their own homes. The impact so far is we've had about 41 project interns complete the basic level training. In year 2, the initial group that started with in year 1 was able to step up and serve as co-trainers during the second face-to-face training. So that was a huge sense of empowerment and really building capacity and taking a group of folks from where they were to a higher skill level. And then in the second year, they are now in a position where they can take a leadership role in training others and empowering others in the same field. And that's the final slide of our presentation. So thank you very much for the time and your attention and the opportunity to share a little bit about our Samoan culture and our project and how we're working to help improve the quality of life of people here in American Samoa. Waftai.
Thank you so much, Katie, for that overview of life in American Samoa. If you haven't been to American Samoa, I highly recommend the visit, if just to see, like, what Katie was saying, how vibrant and, dynamic their culture still is today. So thank you once again, Katie. Next, we'll be talking about the native people of Hawaii. And on screen there, you can see the Hawaiian Islands, the main populated islands there in green, but you can see how the islands actually are a long archipelago that includes lots of small atolls as well. So at this time, I'd like to introduce our presenters today from Hawaii. We have program specialist Shane Kukunaokala Yoshimoto, who has been with the organization Blueprint for Change since November 2015. Mr. Yoshimoto has a bachelor's degree in Hawaiian Studies and a master's degree in social work, both from the University of Hawaii at Manoa. And he has over 10 years experience in working with children, youth, and families in Native Hawaiian communities. Executive Director and Principal Investigator Stephen Kanea'i Morse has been with Blueprint for Change since November 2008. Mr. Morse has a master's degree in social work as well from the University of Hawaii at Manoa and over 45 years of experience in working with communities throughout Hawaii. And we are honored to be able to feature Kukunaokala and Stephen Kanea'i today to present a little on the people of Hawaii and their project. So at this time, I'd like to pass it off to them to tell us more about their project.
Kako, my name's Stephen Morse. I'm the principal investigator for the A Ho'okanaka project that we have funded by ANA for 1 year. It started October 1st. My traditional name is Kaʻānaniʻau. I am a son or a man of the E family from the Hamakua coast on the island of Hawaii here in the archipelago. I wanted to just first note that the Hawaiian Islands actually many years ago were referred to by the natives as Kaʻānaniʻau. That was the official name of the archipelago given by the native people at that time. Native Hawaiians today are descendants of Polynesian wayfinders who arrived in the Hawaiian archipelago from the Marquesas and Tahiti in migrations between around 400 to 600 AD. They found their way here in Wa'akaulua, double-hulled voyaging canoes using only the sun, the moon, stars, waves, and currents and birds as their only guides. In the 1,000 years that ensued before contact with the outside world, they built a complex subsistence economy using their acute observations of the cycles of the moon and other natural elements to devise food and preservation systems, a few of which are still used today. With their food secure, they became expert lawaya, fishermen, mahiai, farmers, and craftsmen, building a thriving, sophisticated culture par none. When Captain James Cook, the British explorer, arrived in what was known as Kaʻānaniʻau, the Hawaiian Islands, in 1779, he estimated the native Hawaiian population at 400,000 people. In his journals, he frequently referred to the people as healthy, robust, friendly, hardworking, and fun-loving with a love for games that required athletic skill. It's unfortunate, but we need to note that Cook, like other Western explorers, regarded the native people he encountered as an inferior race. He claimed to have discovered Hawaii, naming it the Sandwich Islands after his British benefactor, and completely disregarded the fact that it was our Polynesian ancestors who approximately 1,500 years before who first arrived after voyaging thousands of miles of open ocean at a time when Great Britain and Europe were still living in the Dark Ages. Native Hawaiians have not fared well since contact with the West. Cook and the Westerners who followed brought diseases like influenza, cholera, measles that killed thousands of Hawaiians. The abolishment of the kapu system, a system of laws and edicts that governed almost every aspect of daily life in the 1820s, left the native people rudderless. And when changes to the land tenure system began occurring in 1850, changing land ownership from a basic communal system to fee ownership, it started the alienation of Hawaiians from their own land. Near the end of the 19th century, the Hawaiian population had shrunk to less than 50,000 people. Most were in a poor state, and the future status of Native Hawaiians was in great jeopardy. In 1893, the overthrow of Queen Liliuokalani and the Hawaiian government by American merchants and descendants of missionaries, aided by U.S. Marines from the U.S. Boston, though challenged and protested by Native Hawaiians at every level of government, eventually led to what many Hawaiians still consider the illegal annexation of Hawaii by the United States government. With the loss of sovereignty, the overthrow seemed to have been the coup de grace for Native Hawaiians. They experienced extensive repression, loss of land, and the decimation of language and cultural systems. Poverty and a myriad of chronic health problems and other negative social indicators, including the highest rate of incarceration in the state of Hawaii, prevailed. But in the 1970s, there emerged a renewed sense of pride in being Hawaiian and reviving the culture. The Hawaiian Renaissance, as it was called, was initially spawned by a new generation of contemporary Hawaiian musicians and the building of a great wa'a kaulua called Hokulea. The emergence of young Hawaiian advocates and community leaders brought about hope for social change and justice. Protests like the occupation of the island of Kaho'olawe as a symbol occupation in protest of the bombing by the United States Navy in 1976 brought more public focus and interest in improving the status of Native Hawaiians moving forward. And in 1978, the Hawaii State Constitutional Convention convened and brought landmark decisions for Native Hawaiians that solidified their rights and place as the first people in Hawaii, including naming Hawaiian the official language of the state of Hawaii. The renewed sense of pride in culture that was generated during the latter part of the 20th century was reflected in the fact that more people were identifying as being Native Hawaiian. In the 2000 census, the total U.S. population of Native Hawaiians was reported at 401,162 individuals, of which 239,655 resided in Hawaii. In the 2010 census, the total U.S. population increased to 527,077, 289,970 who resided in Hawaii. But we are still dealing with challenges brought on by Western impact and the trauma of the past. And for our next section, I'd like to turn it over to Kukuna Okala.
Hi, aloha mai kākou. Again, my name is Kukuna Okala Yoshimoto, the program specialist with Blueprint for Change. And I'm honored here today to share with you a little bit about Blueprint for Change and our Ho'okanaka project. Blueprint for Change is a nonprofit organization whose mission is to develop and support family-centered, community-driven service delivery models that assure the safety and well-being of children who have been identified as at risk for abuse and or neglect. Our vision is every child in Hawaii will grow up in a loving family, a nurturing home, and a safe environment. Childhood experiences, both positive and negative, have a tremendous impact on future violence, victimization, and perpetration, and lifelong health and opportunity. Thus, we know that early experiences are an important public health issue. Much of the foundational research in this area has been referred to as adverse childhood experiences, or ACEs. ACEs have been linked to risky health behaviors, chronic health conditions, low life potential, and even early death. As the number of ACEs increase, so does the risk for these outcomes. About 5 years ago, we began noticing an increase in support services being given to families that have been impacted by incarceration, which prompted us to find out just how big this issue was. How many children were being impacted by parental incarceration in Hawaii? Long story short, a pilot data collection in February of 2016 gave us a ballpark number. With approximately 1,300 intakes through the Department of Public Safety, about 600 keiki, or children under the age of 18, were impacted by parental incarceration every month. This staggering statistic prompted us to begin to strategize different ways that we could help address this rapidly growing concern. The first strategy was to figure out ways that we could help to increase support and services for children and families impacted by incarceration. One way we addressed this strategy was through the collaborative development of a pamphlet titled Help Guide for Families of Those Serving Time. In the pamphlet, there's information about the bail bond and court processes, along with contact information for all in-state and out-of-state facilities where their loved one may be. The brochure also includes contact information for support programs and services across the state of Hawaii. The second strategy was to support those previously as well as currently incarcerated parents in navigating the sometimes overwhelming process of reunification, in order for them to return to a better, if not the best version of themselves for their keiki, their children, their ohana, their family, and their kaiaulu, their community. As the stars began to align, Blueprint for Change was blessed to be invited to join a working group called Holomua Pu'uhonua. Holomua Pu'uhonua gave Blueprint for Change the opportunity to join a hui or a group comprised of like-minded and equally passionate advocates, service providers, retired state corrections officers, Hawaiian cultural practitioners, and ex-offenders in taking a hard look at Native Hawaiian incarceration and the disproportionate representation of Native Hawaiians in the criminal justice system. This hui or group was started by our late and beloved kupuna, Uncle Joe Ili Ili Puna Tasso, pictured here sitting on the bottom right-hand side next to the governor of the state of Hawaii, David Ige. The group spent countless hours discussing the problem, which eventually and naturally led to countless hours of discussing possible solutions. One solution bubbled to the surface, mainly because the group saw it as the path of least resistance, the low-hanging fruit, if you will. An avenue through which we would create opportunities to begin systematic change on multiple levels. This path we saw was through education, specifically cultural values-based education. Which brings us to the E Ho'okanaka project. The project operates from the premise that the current rehabilitation and reintegration programs and services lack the cultural root values, practices, and principles necessary to reduce the high recidivism rates and to foster self and familiar reconnecting among Native Hawaiians. The main goal and focus of the project is to develop curriculum that reconnects former Native Hawaiian pa'ahau or incarcerated persons to their traditional Native Hawaiian root culture, values, practices, and principles. Phase 1 of the E Ho'okanaka project is aimed at developing a core curriculum using Kaulana Mahina, or the Hawaiian moon calendar, to begin the process of E Ho'okanaka, becoming a person of worth. Kaulana Mahina, the Hawaiian moon calendar, we know incorporates thousands of years of ancestral knowledge, practices, and principles, which we felt was a near-perfect fit for what the intention of the curriculum was. The E Ho'okanaka project curriculum encompasses fundamental cultural elements and practices necessary to restore the once fixed foundations through the understanding of ancestral dogma, to restore the harmony and balance through relationships, spirituality, and environment to allow for rebirth and successful reintegration into society. Mahalo a Nui Loa for letting us share a little bit about our project. For more information, please feel free to visit either one of our two websites here, www.blueprintforchange.org and or www.eho'okanaka.org. Mahalo.
Mahalo kukuna kala and Mr. Morse for that presentation. That was a great overview of the history of Native Hawaiians leading up to effects we still feel today. And, it was great to get a glimpse into the good work that you're doing over at your project at Ho'okanaka. So thanks again for taking the time to share that with us all. At this time, I'd like to move into our Q&A session. If you have any questions for today's presenters, you can type them into the chat box at the bottom right corner of the screen, and I'll direct them to one of the presenters. And if you want to ask, someone in particular, just direct it at that person if you'd like. The first question we have is from Shafton. Can I get a copy of this presentation? So everyone who attended this session live will receive a copy of the PowerPoint by email and a follow-up email to be sent right after this. And the recording of this session will also be posted online sometime next week. And a direct link to that recording will be emailed to you in follow-up as well, using the email address that you registered with. Our next question comes from Juan Flores. Have the projects presented received ANA grants? Good question. Yes, they have. Both are current grantees here in the Pacific. And I'd like to have them talk a little more about what that application process was like, especially since right now ANA's grant applications are open. So if you would like to apply for an ANA grant to do something like what you saw today, we are currently taking applications, which will be due on July 22nd, and your regional TTA centers can help you put together your applications for free. But let me start with Katie from Samoa. Katie, could you please talk a little about how the grant application process was for you?
Thank you. Well, my grant experience with the ANA project actually started with the training. One of the ANA trainings that was conducted here in American Samoa for program planning and development. That was instrumental as far as a tool, guidance, and resources that helped us with our planning process. So we had worked with our community groups, with the board of Hope House. We knew that the project, we wanted to center it around caregiving. And so we just followed the guidance, followed the toolkit. We went through archive data, looked for partners who are willing to work with us, who are currently in the providing services for our target population. And then we came up with our logic model, created the goals and objectives. We're very specific. And again, I can't emphasize enough, if you're looking to apply, that guidance and toolkit and the pre-application manual that ANA provides is going to be key. If you just follow that, you will be on track, because it was after my first training and then following the RFA together with the pre-application kit and helping to facilitate the planning process with our folks that we were able to receive funding on our first try. So we were very excited and grateful for the technical assistance from the Hawaii office.
Thank you, Katie. And Kukunaokola, do you have anything to add about that, your experience with ANA grant?
Mahalo, Matt, and mahalo, Katie. I think we want to first echo what Katie mentioned about taking advantage of your regional TTA centers. If it wasn't for Matt, Keone, and Apua folks out there helping us, supporting us, guiding us throughout this whole process, I'm telling you right now, it would not have happened. So first and foremost, mahalo to you folks for always being there to answer questions and guide us on this path. Secondly, as you'll hear if you attend pre-application trainings, the importance of getting community input. I think that was one of our strongest points in our application, being the fact that the work we're doing is a continuation of what has been done over the last 15 years. And to document that and to have, again, documentation that can show the work that was done by community groups or communities themselves is going to be really important to help your application succeed. Stephen.
This is Kaʻānaniʻau. I just wanted to add, again, mahalo to the TA and Kaʻānaniʻau. Tremendous support for our application and are helping us. But I also want to, just basically advise and let people know that there needs to be some patience. This was last year, was not the first year we applied for an ANA grant. We had applied several times in the past, or a couple more times prior to getting awarded. And I think you can't be discouraged by not receiving the grant funds. Use the opportunity to and use the comments from both your TA provider and your peer panel reviewers at ANA to be able to strengthen and improve your application for the following year. Keep at it and don't get discouraged. Keep going.
Thank you very much for both of your feedback, and that really is a good point, Mr. Morris, that if you feel, it's always a good thing to apply for an A&A grant, because one of the things that you will guarantee get back is feedback from the panel reviewers who reviewed your application. And even if you don't get funded, you can use that feedback to improve your application and resubmit it, all fixed up in the next year's funding cycle. So we have another question from Shafton over on Hawaii Island. Shafton asks, so we are working on a program similar to E Ho'okanaka, but in Waipio Valley and focusing on drug abuse. We want to funnel our Pa'ahau brothers and sisters as well. Will our project be too close to E Ho'okanaka to be considered or funded? The answer is no. So ANA aims their funding at specific communities. And so, if your project, the more focused your project is on the communities of Waipio Valley and their specific needs, the better. And so you will be able to find out those specific needs in the community planning process, where you actually assess the needs through, a community meeting or community survey of the community that you are going to be serving with your project, and find out how you can actually tailor things to, the specific way that works for them, the specific types of problems that they're facing, and, the specific culture of your area. I'll pass this off to the blueprint guys, and maybe they can identify some ways that your project might be unique from what they're doing. And and also, just as a side note, I do encourage organizations to partner with each other if you find opportunities to share resources or services in service of our community together. But let me pass that off to the blueprint guys to see if you have any.
Mahalo, Matt, and mahalo, Shafton. Yeah, I mean, we're completely and totally transparently open to partnering. We are in the process of developing another proposal that will be submitted at the end of June. So we'd love to connect with you, talk stories, see where we can help each other out. And I mean, this is a Hawaii thing. This is by no means a blueprint thing or an organizational thing. I think it's a Hawaiian thing, first of all. Um, and the more we can collaborate and talk story and help each other, I think the better. So definitely, thanks for the email. I'll definitely shoot you an email and we can start talking story. Mahalo.
Awesome. Mahalo, both of you guys. It's always good to see people working together to serve our native people. So we have maybe time for one question. Oh, here we go.
Hi, Matt. Yeah, I just wanted to just add on only because in our program development, ANA had already funded a grantee to provide a similar project for caregiving training in American Samoa, and they were funded when we developed our application. And so what I was able to do was learn more about what their goals and objectives were by speaking with their project director. And in our narrative, I drew a distinction between our project and theirs so that there wasn't an appearance of a duplication of effort or anything like that. So that might be something, as long as you're very explicit about how you're differentiating your project so that yours, like Matt said, meets the needs of your specific target community. I just wanted to share that.
That's a great point, Katie. Yeah, that same thing literally happened in Samoa, and Katie was the second project, in that lineage. It was similar but specific to the community. So thank you for adding that on, Katie. At this point, we do not have time for any more questions. If you have more questions, feel free to direct them to our presenters. Their information will be left on the final slide here. And it'll also be sent out in a follow-up email. And so feel free to contact them with any other questions you may have. So just to wrap up, today our webinar goals were to better understand the Native Pacific Islander communities, specifically of Hawaii and American Samoa. And I think we were very lucky to have had Kukunao Kala and Stephen Kanea'i from Blueprint for Change and Katie from uh, Pacific Development, Pacific Community Youth Development, sorry, Katie, to help us understand those communities today. So thank you very much for your input and mana'o today. And so they talked to us about how their ANA funded projects are addressing local challenges in these Native Pacific Islander communities. So feel free to reach out to them if you have more questions. Like I said, we present these webinars on Thursday, usually 2 a month. The next one will be on June 8th on the Native Act and how it creates opportunities for economic development through cultural tourism, which, like I said earlier, it has been added as an area of focus on this year's SEDS funding opportunity announcement, our social and economic development strategies grant from ANA. And if you're interested in that, you can register on the ANA Alaska website on www.anaalaska.org or find the full list on the events page of the ANA website. So at this time, I'd like to close the session. Thank you everyone for joining us. Once again, my name is Matthew Ng. I'm the Technical Assistant Specialist here at Kaʻānaniʻau, the operators of the Pacific Region TTA Center, a resource of the Administration for Native Americans. My contact information is there on screen on the left, and you'll also see the contact info for today's presenters there on the right, which I'll leave on screen for a little while. This has been an ANA webinar, Pacific Islander Heritage Month, Ka holo ʻana I ke kai Hohonu, Generations of Resiliency. Today is May 25th, 2017. Thank you once again for joining us, and take care. Aloha.